Okay, think about this for a second. Imagine you're building the most complex, intricate structure ever designed. A brand new human being. You've got this perfect genetic blueprint, right? A strict 9-month schedule, all the materials lined up. But what happens when something from the outside world gets in and starts messing with those plans? Something uninvited, often totally invisible, that can alter the blueprint or just disrupt the whole construction process. Well, that's exactly what we're diving into today, the world of teratogens.
So before we get into all the examples, we need to get on the same page with what a teratogen actually is. It's not just one thing. It's really a catch-all term for any agent. Could be a substance we eat or drink, a chemical in our environment, even a virus that can get past the body's defenses and interfere with how an embryo or fetus is developing. And that interference can look like a lot of different things, from really subtle changes to serious birth defects. In the worst cases, it can even stop the pregnancy altogether. Understanding this concept is absolutely key to making sense of everything else we're about to cover.
All right, here's the game plan for our deep dive. We'll kick things off with substances we consume. Then we'll navigate the tricky world of medication and illicit drugs. After that, we're going to look at some of the invisible threats, things like infections and environmental hazards. And finally, we'll wrap it all up by talking about the core principles behind how this all works and, most importantly, how to think about prevention.
So let's start with a category that, honestly, affects a huge number of people, often without them even realizing the potential risk. We're talking about the everyday stuff. The things that are so baked into our daily routines, our morning coffee, for example, that we just don't give them a second thought. But during that incredibly delicate window of pregnancy, these seemingly normal choices can have a really big and sometimes lasting impact.
Okay, let's really break these down, because the how is what's so important here. Take caffeine. Research has flagged a threshold of more than 4 cups of coffee or soda a day. Get over that line and you start seeing links to a higher risk of miscarriage and low birth weight. Now, nicotine. Wow, this one is in a league of its own. It's a powerful vasoconstrictor, which is just a fancy way of saying it squeezes blood vessels. So when it hits the placenta, it's basically choking off the supply line of oxygen and nutrients. This directly causes growth problems. And get this, nicotine is so good at crossing the placental barrier that its concentration can be even higher in the fetus than in the mother. This is a huge factor in why it's connected to sudden infant death syndrome, or SIDS. As if that wasn't enough, it also acts like a facilitator, basically opening the door for other harmful things to get through more easily. And then you have marijuana. Its compounds can directly impact the development of the amygdala, which is the brain's command center for emotions. For a newborn, this can show up as tremors, really disturbed sleep, and even a strange lack of interest in what's going on around them.
And that brings us to one of the most well-known and one of the most destructive teratogens out there, alcohol. The damage it can do is so significant that the effects are broken down into 2 distinct disorders. You see, alcohol works its harm in a couple of ways. Indirectly, it messes with how well the placenta works throughout the pregnancy, but it also does direct damage, physically harming the developing brain and messing up how neurons get to where they're supposed to go. How bad that damage is and what it looks like really depends on the level of exposure, and that's what leads us to this crucial difference between fetal alcohol syndrome and fetal alcohol effects.
Now, this chart gives us a great side-by-side, but the nuance is what's really important. Fetal Alcohol Syndrome, or FAS, is the more severe condition. It's what you typically see with heavy, consistent drinking. It's marked by that very specific set of facial features, which are basically external signs of a major disruption early in development, along with really significant cognitive and behavioral challenges. But on the other side, you have Fetal Alcohol Effects, or FAE. This is linked to lower levels of exposure. And here's the tricky part. The physical signs might be really subtle or not there at all, but, and this is a huge but, the damage to the central nervous system, the cognitive and behavioral problems are still very much present. To get an official FAS diagnosis, a doctor has to see all 3 things: the growth deficiency, those specific facial abnormalities, and the brain dysfunction. FAE is what's diagnosed when some, but not all of those are present. It really hammers home that there's just no known safe amount of alcohol during pregnancy.
Okay, let's shift gears now. We're moving into a different category of substances, things that are either taken for medical reasons or used illicitly. And this is where the conversation gets a lot more complicated, because often you have to do this really difficult calculation of weighing the potential benefit of a substance against its inherent risk.
You know, so much of what we understand today about medication risks has been learned the hard way through some really tragic, unforeseen events. Back in the 40s through the 60s, a drug called DES was given to women to prevent miscarriages. It wasn't until decades later that we discovered the daughters of these women had serious reproductive issues and a higher risk of rare cancers. Then, in the 60s, you have the Thalidomide disaster. It was sold as a completely safe fix for morning sickness, but it caused phocomelia, a devastating condition where limbs are malformed or missing entirely because the drug hit at the exact critical moment those limbs were supposed to be developing. Even today, with stuff we see as totally normal, like over-the-counter pain meds, there are known risks. Aspirin is linked to growth issues, and ibuprofen, particularly late in pregnancy, can actually cause a prolonged delivery.
This whole history really leads us to one of the toughest ethical questions in prenatal care today, one that millions of expecting parents and their doctors wrestle with. How do you decide when the potential risk of a medication is actually less than the very real, definite risk of an untreated illness? And there's really no better example of this than the antidepressant dilemma.
This is the classic risk versus risk situation. On one side, you have the case for using antidepressants. Untreated severe depression isn't something you can just ignore. It has its own massive risks, like maternal self-neglect, poor nutrition, even thoughts of self-harm. Plus, the high levels of stress hormones like cortisol that flood the system during depression can cross the placenta and negatively impact the baby's brain development. But then, on the other side, you have the arguments against them. Some antidepressants are linked to something called neonatal adaptation syndrome, which is a temporary withdrawal-like state in newborns that causes things like tremors and irritability. And some very specific drugs, like lithium, have been tied to a higher risk of heart defects. So what do you do? Well, the decision often comes down to severity. For milder depression, therapy might be the answer. But for severe, debilitating depression, the risks of the illness itself can far outweigh the risks of the medication.
When we turn to illicit drugs, the way they cause harm is often brutally direct. This quote about cocaine just says it all. It's a powerful vasoconstrictor. It squeezes blood vessels, but it does this to both the mother and the fetus. So you get this devastating 1-2 punch. The fetus's blood pressure skyrockets, while at the very same time its supply of oxygen and nutrients is being choked off. It's just a terrible combination for development. The ripple effects of illicit drug use are just heartbreaking and so complex. If we look at opiates like heroin or methadone, the most dramatic damage actually happens after birth. You don't usually see major physical abnormalities, but a staggering 60 to 80% of these babies go through a horrific withdrawal period. We're talking high-pitched screaming, tremors, vomiting, and terrible sleep problems that can go on for months. With cocaine, that blood vessel constriction often leads straight to miscarriage or premature birth. For the babies who make it to term, they're often incredibly irritable and lethargic, which can make that crucial parent-child bonding process really difficult. And the problems don't stop there. Long-term, cocaine exposure is linked to a whole host of cognitive issues, trouble with attention, with language, and with higher-level functions like planning and self-control. All right, we're shifting our focus again. We've talked about things you consume. Now, let's talk about threats you might contract, like an illness, or just encounter in the environment around you. These are the invisible threats, and their impact can be every bit as serious. Some of the stats in this section are they're staggering, and they really show why just being aware is so important. If a newborn contracts genital herpes from their mother during delivery, 1/3 of them won't survive. And of the babies that do survive, another 1/4 to 1/3 are left with permanent blindness or brain damage. But here is the absolutely critical piece of information. Most of these infections happen during the birth itself, and that means this awful outcome is often completely preventable with a C-section. It's so important to realize that an illness that might be a total non-issue for an adult can be catastrophic for a developing fetus. Take rubella, or German measles. For an adult, it's a mild rash. But if a mother gets it early in pregnancy, when the eyes, ears, and heart are just starting to form, it can cause blindness, deafness, and heart defects. Or something like toxoplasmosis, a parasite you can get from cat litter or undercooked meat. For you, it might feel like a minor cold, but for a first trimester fetus, it can cause severe damage to the eyes and brain. And then there's HIV/AIDS. Now, modern medicine has done wonders to reduce mother-to-child transmission, but without that treatment, a huge number of infected babies won't survive past their 6th birthday.
When an infection happens, it can be everything. Timing is absolutely critical, and the disease syphilis is the perfect example of this. For the first 4 months of pregnancy, there's a special layer of cells in the placenta that acts like a bouncer at a club. It physically blocks the syphilis bacteria from getting to the fetus. But after that 4th month, this protective layer just naturally disappears. The gate is wide open.
and now the bacteria can cross over and cause all sorts of devastating damage, stillbirth, or serious harm to the baby's eyes, ears, bones, and brain. This is exactly why early screening and treatment with simple antibiotics is one of the most effective interventions in all of prenatal care.
Finally, let's touch on hazards in our environment. High doses of radiation, like from non-essential X-rays or CT scans, have been linked to miscarriage and mental retardation. The basic rule is to just minimize exposure as much as you possibly can. Then you have chemicals and pollutants. Heavy metals like lead and mercury are well-known teratogens that can cause both physical deformities and intellectual disabilities. And this is a really important point. The risk doesn't just lie with the mother. Some chemicals in the environment can actually damage the chromosomes in a father's sperm, which can lead to a miscarriage or a child with genetic defects.
Okay, so after going through this pretty intimidating list of risks from coffee to chemicals to common infections, what are the big picture rules? What are the key principles you should really take away from all this? The damage caused by teratogens isn't just random chaos. Scientists have figured out a clear set of principles for how they work. First up is timing. When the exposure happens is everything. We saw this with rubella, which is most dangerous in the first trimester, when all the major organs are being built, and with syphilis, which can't even get through until after the 4th month. Next is dosage. As a general rule, the more you're exposed to, the worse the damage. The difference between fetal alcohol syndrome and fetal alcohol effects is a perfect illustration of this dose effect. Third, there's genetics. A person's unique genetic makeup can make them more or less susceptible to harm. And finally, there's specificity. Different teratogens do different things. They cause predictable patterns of damage. Thalidomide went for the limbs. Rubella targets the eyes, ears, and heart.
Look, the point of this whole explainer isn't to create fear or anxiety. It's about empowerment through understanding. So after looking at this huge, complex web of potential risks, it all really boils down to one final crucial question. What is the single most powerful tool that we have? And that's it. That's the key. The goal isn't to memorize every single potential threat out there. It's about having an awareness of the different types of risks that exist. And, most importantly, it's about starting a conversation with a healthcare professional right from the very beginning and keeping that conversation going. That combination, proactive knowledge and expert personalized guidance, is the absolute best defense against all these hidden risks. And it's what turns anxiety into empowered, informed decision-making.